morning, everyone. All are requested to kindly keep your phone on silent mode. Please keep your phone on silent mode. We are awaiting the arrival of our honorable chief guest, so we'll be starting the program shortly. Hello. 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 একটু স্লো। Hello. 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 All are requested. Our Honorable Audience members are kindly requested to settle down. We are about to start the program. All are requested to kindly keep your mobile phones on silent mode. A very good morning to all of you at Dr. B.C. Roy College of Pharmacy and Allied Health Sciences. It gives me immense pleasure to welcome you all to Bcrcp Natcon 2025, a national conference that brings together scholars, researchers, academicians, industry professionals, and students under one roof to deliberate, share, and grow together. At the outset, I extend my warmest greetings to our esteemed Chief Guest, Shri Pradip Kumar Majumdar Sir, Honorable Minister in Charge for the Department of Panchayats and Rural Development and Department of Cooperation, Government of West Bengal, to share his valuable time with us. On behalf of entire Bcrcp fraternity, I welcome you, sir, to Dr. B.C. Roy College of Pharmacy and Allied Health Sciences. We also extend our heartfelt thanks to you, sir, for inaugurating the M.L. Shroff Auditorium on this very special occasion. The auditorium, taking inspiration from the contributions of Professor Mahadev Lal Shroff, the father of pharmacy education in India, will be dedicated to academic excellence and cultural harmony. I also take this opportunity to welcome our respected society members, dignitaries, invited guests, and enthusiastic delegates who have joined with us here today. Your presence not only graces this event, but also reaffirms our commitment to excellence in pharmaceutical education and research. We are proud to be hosting this significant event, Bcrcp Natcon 2025, which will serve as a venue for confluence of minds and hence to welcome the ever-changing dynamics of technology. The theme for the conference is Beyond Boundaries, Pioneering the Next Wave of Therapeutic Solutions. The sessions lined up over the next 2 days will explore cutting-edge topics with a focus of emerging trends in technology. So, without any further ado, let us begin with the auspicious inaugural session. To begin with this prestigious session, we would like to request our esteemed dignitaries on the dais. At the outset, I would like to request our Honorable Chief Guest, Shri Pradip Kumar Majumdar Sir, Honorable Minister in Charge for the Department of Panchayats and Rural Development and Department of Cooperation, Government of West Bengal, to the dais. Audience, please give a huge round of applause. Thank you, sir. Now I would like to welcome our respected Chief Patron of Bcrcp Natcon 2025 and President of Dr. B.C. Roy Society, Dr. Satyajit Bose, sir, to the dais. Thank you, sir. I take this opportunity to welcome our respected General Secretary of Dr. B.C. Roy Society and Patron of Bcrcp Natcon 2025, Mr. Tarun Bhattacharya, sir, to kindly grace the dais. Thank you, sir. Now, I would like to request our Honorable Chief Advisor and Patron of Bcrcp Natcon 2025 of Dr. B.C. Roy Society, Professor Shoikat Moitra, sir, to the dais. I would now like to request our Honorable Principal of Bcrcp and Chairman of Bcrcp Natcon 2025, Professor Shomir Kumar Samanto, to the dais. And last but not the least, I take this opportunity to request our Honorable Keynote Speaker, Professor Bhashwata Sundar Chakraborty Sir, Founder President of 4C Consultant, Toronto and Ahmedabad, to grace the dais. As a mark of honor and respect, we would now like to felicitate our esteemed dignitaries on the stage. At the outset, I would like to request our respected President of BC Roy Society and Dr. Satyajit Bose and our Honorable General Secretary, Sir, Mr. Tarun Bhattacharya, to jointly felicitate our Honorable Chief Guest, Shri Pradeep Kumar Majumdar, Sir. Thank you, sir. I would now like to request Professor Shomir Kumar Samanto, Principal of Bcrcp, to felicitate our Honorable Chief Patron of Bcrcp Natcon 2025 and President of Dr. B.C. Roy Society, Dr. Satyajit Bose, sir. Thank you, sir. I will also like to request our Honorable Principal, sir, to felicitate our Honorable General Secretary, Mr. Tarun Bhattacharya, sir. Okay, sir. I would like to request our Honorable Principal, sir, to kindly felicitate our Honorable Keynote Speaker, Professor Bhashwata Sundar Chakraborty, sir. Thank you, sir. Tvameva mata cha pita tvameva, tvameva bandhus cha sakha tvameva, tvameva vidya, dravinam tvameva, tvameva sarvang mama deva deva. Let us now elevate the aura of this gathering with a divine song by Shagnik Bonik of a B.Pharm third year student.
Hello. Hello. মঞ্চে এবং দর্শক আসনে উপস্থিত সকলকে আমার আন্তরিক শ্রদ্ধা এবং বিনম্র প্রণাম জানিয়ে আমি এই শুভ অনুষ্ঠানের সূচনা করতে চাই সরস্বতী বন্দনার মাধ্যমে। কুন্দেন্দু তুষারহার ধবলা কুন্দেন্দু तुषारहार धवला या श्वेतवस्त्रावृता या वीणा गुरुदण्डमण्डिताकरा या श्वेतपद्मासना या ब्रह्माच्युतशङ्कर प्रभृतिभिर्दैवैः सदा पूजिता सा मम पत्तु सरस्वती भगवते निःशेष जाड्यपः सरस्वती नमो नमः सरस्वती नमो नमः सरस्वती नमो नमः थैंक यू
Symbolizing growth, sustainability, and blooming of knowledge, we shall now proceed to the inaugural of the conference by the traditional gesture of watering the sapling. We request our esteemed Chief Guest, Sir, and dignitaries on the dais to do the honors. I would also like to request Honorable Society members and dignitaries seated in the front row to kindly join in for the ceremonial watering of the sapling. Thank you, Honorable Chief Guest Sir and dignitaries, for the proceedings. I now request Professor Shomir Kumar Shamanto, respected Principal and Chairman of this grand event, to deliver the inaugural address and formally declare the commencement of Bcrcp Natcon 2025, sir.
Very good morning to everyone. Honorable Chief Guest, Mr. Pradeep Kumar Mujumdar, Minister in charge, Department of Panchayat and Rural Development, and also Department of Cooperation, Government of West Bengal. Respected Chief Patron and President of our Society, Dr. Satyajit Bose, Honorable General Secretary of our Society, Mr. Turun Bhattacharya, Professor Shoikot Moitro, our Chief Advisor and former Vice Chancellor of Macau, that is Maulana Abul Kalam Azad University of Technology. Respected keynote speaker, Professor Bhashwat Sundar Chakraborty, esteemed other society members present over here, distinguished guest, speaker from different organizations, and most valuable delegates. It is both an honor and privilege to me to welcome all of you to this conference on the theme Beyond the Boundaries, Pioneering the Next Wave of Therapeutic Solution. On behalf of organizing committee, it gives me immense pleasure to extend warm greetings to each of you who has gathered over here to explore, to exchange, to extend the horizons of therapeutic innovations. This conference is not merely an event. It is the celebration of innovation, collaboration, and pursuit of therapeutic solution. The theme, Beyond the Boundaries, reflects our ambition to overcome the traditional approach and explore the unexplored territories in the field of pharmaceutical sciences. Together, our aim is to challenge the conventions and bridge gaps and push the boundaries of the scientific discovery. This conference will provide us a platform where we can embark a journey to discuss the cutting-edge technologies, groundbreaking therapies, and integration of technology and compassion in the medical science. I am proud that this conference is organized by our esteemed organization, that is Dr. B.C. Rai College of Pharmacy and Allied Health Sciences, which is a hub of knowledge, research and development for many years. The effort of our staff and faculty members, students, management, and entire organizing team has arranged this wonderful platform where the researcher, academician, industry expert, policymaker, students come in a same platform to share their ideas, experience, and insights. Pharmaceutical technology, which is rapidly advancing, driven by the innovations like artificial intelligence, machine learning, mRNA technology, and so on. Artificial intelligence and machine learning, which has made a revolution in the field of drug discovery by enabling the predictive models which streamline the research, reduce the cost, and accelerating the development of personalized medicine. Personalized medicine, which tailored the treatment on the basis of genetic makeup of an individual. Really, it is a transformation in the field of patient care, reducing the side effect and increasing the efficacy. In the coming days, we will learn, we will hear some lectures from the most brilliant mindset who are leading the groundbreaking research and transforming the changes in the drug development and drug development and healthcare solution. Their expertise and insight will undoubtedly inspire us to think critically and creatively about the scope and challenges in front of us. Anyway, we are deeply grateful for the presence of our chief guest, Mr. Pradeep Kumar Majumdar. Within his busy schedule, he has taken time to join with us. Sir, we are really grateful to you. I also take the opportunity to express my gratitude to all the dignitaries, speakers, and delegates across the nation. In conclusion, I must encourage to each of you to participate wholeheartedly, to engage in the exchange of ideas, and to embrace the spirit of learning and discovery. Let us make this conference a testament of our commitment to improve the lives by the advancement of the pharmaceutical research and innovation. Once again, I would like to welcome all of you to our conference, that is the Beyond Boundaries, pioneering the next wave of therapeutic solution. I wish you all an enriching experience during the conference. Thank you all. Have a nice time.
Thank you, Honorable Sir, for the insightful inaugural address. I would now like to request our Honorable Chief Patron and President of the Society, Dr. Satyajit Bose, sir, to address the conference.
Good morning, everybody. It's my pleasure to have Mr. Pradeep Majumdar with us. He is not only a minister, but a great educationist and one of the most literate persons that we have in this gathering today. And, and we have our General Secretary, Mr. Tarun Bhattacharya, our Chief Advisor, Mr. Saket Maitra, Principal Shamantu Sahib, and also Professor Chakraborty from Canada, and a host of other intellectuals from all over, and my co-society people, Mr. Janal Singh and Mita Mitra. Thank you, and well, it is my distinct pleasure to welcome you to a conference themed Beyond Boundaries, Pioneering the Next Wave of Therapeutic Solutions. I'm thrilled to expect so many passionate individuals gathered here, united by our commitment to advancing the field of pharmacy and enhancing patient care. In the recent years, we have witnessed remarkable innovations that challenge the traditional paradigms in therapeutics, from groundbreaking biologics to the integration of artificial intelligence in drug discovery, as said by Professor Samir Kumar Samanta. And the landscape of healthcare is evolving. Because I'm in the middle of healthcare, I know how pharmacy is evolving at an unprecedented rate. This CME aims to explore this advancement, highlighting how we can transcend conventional boundaries to develop the more effective and personalized therapeutic solutions. Across sessions, we have great speakers with us, both outside and inside the organization, and we will engage with leading experts who are going to share their insights on the emerging therapies, novel drug delivery systems, and the role of pharmacists in the interdisciplinary healthcare teams. Pharmacies, my dear, are no longer like dispensing medications. You have a huge role to play in today's modern medicine, from antibiotic resistance to everything. And, you know, you guys are the main people that are between us and the nurses and the patients. So your role is very perfunctory and very important. So you have to understand how you can work on that role, become clinical pharmacists, engage yourself in research and all of that. So these discussions will not only broaden our understanding, but also inspire us to think creatively about our roles in shaping the future of pharmacy practice. I encourage each of the students here to actively participate. Please ask questions, because the kind of questions that you ask to the speakers will also understand that my lecture is being understood and being comprehended, and then we need a rebuttal as well. And share your perspectives. Together, we can foster an environment of collaboration and innovation that will benefit our profession and the patients that we ultimately serve. Thank you very much for being here and your dedication to lifelong learning. You're a pharmacist. Like us doctors, you need to reinvent yourself every time and keep on learning and keep updating your knowledge. Let's embark upon this journey beyond boundaries as we pioneer the next wave of therapeutic solutions. Thank you very much for being here, and have a great session for learning. I'm the chief patron, but I also have responsibilities in the hospital as a cardiac surgeon. And as I was lo behold, what happened, this patient that they have taken to the OT has developed some low blood pressure problems, and I'll have to rush. Please excuse me for going away just now, and thank you very much for patience.
Thank you very much, Dr. Bose, for your enriching words with us. I would now like to request our esteemed General Secretary, Mr. Tarun Bhattacharya, sir, to share his valuable insights for this conference, sir.
নমস্কার। আমি প্রথমেই আজকের যিনি প্রধান অতিথি মাননীয় মন্ত্রী শ্রী প্রদীপ মজুমদার, তাকে অভিনন্দন এবং ধন্যবাদ জানাই, এবং মঞ্চে উপবিষ্ট আমাদের প্রেসিডেন্ট যিনি এখনই চলে গেলেন, ডক্টর সত্যজিৎ বোস, আমাদের মঞ্চে উপবিষ্ট প্রিন্সিপাল, এবং প্রফেসর চক্রবর্তী যিনি কানাডার নাগরিক এবং বিশিষ্ট একজন সায়েন্টিস্ট, এবং আমার সামনে উপবিষ্ট দুর্গাপুর গভর্নমেন্ট কলেজের প্রিন্সিপাল, আরও অন্যান্য বাইরের ফ্যাকাল্টি এবং মাই ডিয়ার স্টুডেন্টস এবং ডেলিগেটসরা, আমি শ্রী প্রদীপ মজুমদারকে ধন্যবাদ দিতে চাই আরও বিশেষ করে এই জন্যই যে আমি যখন ওনাকে রিকোয়েস্ট করেছিলাম এই অডিটোরিয়ামটি উদ্বোধন করার জন্য এবং এই প্রোগ্রামটা আসার জন্য, তো আজকের দিনটা হচ্ছে শুক্রবার, পুরোপুরি ওয়ার্কিং ডে। এখন একটা ক্যাবিনেট মিনিস্টার, সিনিয়র ক্যাবিনেট মিনিস্টার, যার হাতে অনেকগুলো ডিপার্টমেন্ট আছে, তার পক্ষে আসাটা সত্যি খুব কঠিন, কিন্তু উনি খুব সহৃদয় ব্যক্তি এবং আমাদের সঙ্গে প্রথম থেকেই আছেন, আমাদের ভালো মন্দের সঙ্গে, এবং উনি বিজয় শিডিউলকে ছেড়ে আজ রাজি হয়েছিলেন এখানে আসতে, এবং উনি আমাদের এই মহতী অনুষ্ঠানে উনি আমাদের উদ্বোধন করলেন হলের, এবং উনি ওনার স্পিচে উনি ওনার মূল্যবান বক্তব্য বলবেন। এবং এটাও উল্লেখযোগ্য যে উনি এখানকারই দুর্গাপুর পূর্বের স্থানীয় বিধায়ক। আমাদের ইউনিভার্সিটির জন্য আমরা অনেক দিন ধরেই চেষ্টা করছিলাম এবং সেটা একটা পর্যায়ে এসে পৌঁছেছে, এবং তার জন্য মাননীয় শ্রী প্রদীপ মজুমদারকে আমরা অভিনন্দন এবং ধন্যবাদ জানাই যে তিনি এই ব্যাপারে আমাদেরকে সহযোগিতা করেছেন এবং আগামী দিনেও করবেন। আজকের যে বিষয়, সেই বিষয়টা আপনাদেরই বিষয়, আমার খুব একটা জ্ঞান নেই, আমি খুব একটা সময়ও নেব না। আমি এটুকু আপনাদের কাছে বলতে পারি যে আজকের যে অনুষ্ঠান, যে ফার্মাসির যে প্রোগ্রাম, দুদিনের জন্য যে অ্যানুয়াল কনফারেন্স ন্যাটকম, আমরা জানি চিকিৎসা শাস্ত্রে ডাক্তাররাই বোধহয় সব কিছু, বা একটা বড় আধুনিক হসপিটালই সব কিছু, এটা বোধহয় অধিকাংশ লোকের আমাদেরও ধারণা। কিন্তু যদি আমরা একটু ভেতরে গভীরে গিয়ে দেখি, আবিষ্কারক কিন্তু যারা ফার্মাসি সেক্টরে আছেন তারাই। মানে আয়ুর্বেদিক যখন শুরু হয়েছিল গাছগাছড়া থেকে, পরবর্তীকালে হোমিওপ্যাথি এবং অ্যালোপ্যাথি, সব কিছুই সৃষ্টি কিন্তু যারা এই ব্যাপারে যারা রিসার্চ করেছেন, এবং সেই রিসার্চের মাধ্যমে আমরা মানে পৃথিবী জুড়ে যেসব রোগে আগে মারা যেত, সেই সমস্ত রোগের তারা নির্ণয় করেছেন এবং চিকিৎসা করেছেন। এখনকার দিনে মানুষ ভালো হয়ে যাচ্ছে, এবং পিকুলিয়ার যে সমস্ত রোগ এখন মানুষের জীবনে, মানুষের শরীরে বাসা বাঁধছে, আমরা জানি যে এইসব বিজ্ঞানীরা এই নিরলস প্রচেষ্টাতে তারাই ওষুধ তৈরি করছেন বিভিন্ন প্রাকৃতিক এবং রাসায়নিক দ্রব্যাদিকে সংগ্রহ করে, এবং একটা রিসার্চের অনেকগুলো প্রক্রিয়া থাকে। সেই প্রক্রিয়ার মধ্যে যখন সে স্বীকৃত হচ্ছে এবং সেটা মানুষের উপকারে লাগছে, তখন আমাদের তো বলতেই হবে যে এটাই হচ্ছে সবচেয়ে সেরা। চিকিৎসকরা তো চিকিৎসা করেন এই মেডিসিনের উপরই, যে মেডিসিন তৈরি করেন আপনারা। আমি আপনাদের বলতে চাইছি এই কারণেই যে ফার্মাসি সেক্টরটা কিন্তু শুধু ফার্মাসি মানে ওই মার্কেটিংয়ের জন্য নয়, ফার্মাসিটা মূলত হচ্ছে যে কোয়ালিটি অ্যাসুরেন্স এবং প্রোডাকশান এবং রিসার্চের জন্য। তো আমরা এর আগেও একটা ইন্টারন্যাশনাল কনফারেন্স করেছি এই ফার্মাসি কলেজে, এবং আমাদের ইচ্ছা এবং আমরা ডিসিশান নিয়েছি যে আগামী জানুয়ারি মাসে আমরা একটা ইন্টারন্যাশনাল কনফারেন্স করব আবার নতুন করে, এবং সেখানে পৃথিবীর অন্যান্য জায়গা থেকেও আরও সায়েন্টিস্ট যারা আছেন, যারা এই সমস্ত গবেষণা করেন, তাদেরকে নিয়ে আসবো এবং আমরা বড় করে সে অনুষ্ঠান করব। এবং করার মূল উদ্দেশ্য হচ্ছে আপনারা যে আগামী দুদিন ধরে যে আলোচনা করবেন, ডিসকাশন করবেন এবং একটা সিদ্ধান্তে আসবেন, সেই ব্যাপারে যাতে আমরা উপকৃত হই এবং গোটা মানব জাতি যেন তার দ্বারা উপকৃত হয়। এবং আপনাদের সবাইকে এই যে উদ্যোগ, এর সাফল্য কামনা করে এবং সবাইকে অভিনন্দন এবং ধন্যবাদ এবং নমস্কার জানিয়ে আমার কথা আমি শেষ করলাম। নমস্কার।
Thank you, sir, for your insightful words. I would now like to welcome our Chief Advisor, Honorable Professor Shoykot Mitra, sir, to address the audience, sir.
Good morning, all those who are sitting at the dais. Honorable Minister, Mr. Pradip Mojumdar, General Secretary of the Society, Mr. Tarun Bhattacharya, Principal of this institute, Shamesh Samanto. We have a very stalwart speaker, Professor Bcrcp, Founder President, Force Consultant, Toronto and Ahmedabad. And just now, the president of the society is Dr. Satyajit Bose left. I can find some known faces here. Dr. Palit, Moitri, you representing Macau, no? And all other faculty members. Madam Mita Mitra, Vice President of Society, she is also there. And all the faculty members and the most important stakeholders for students program, the students. Now, what I would like to say within the shortest possible time, two aspects of this therapeutic research. One is challenge, another is opportunity. Now the challenge is what? You see this, all this drug discoveries, all these things, that was happened by relentless researches at top-notch universities of the world, and most of these are located at US. And most of these organizations, US pharmaceutical companies, they enjoyed the benefit of the researches of the universities like MIT, Stanford, Harvard, and so on and so forth. They minted millions and billions of dollars, and they proliferated across the entire world. But the research, basic research, fundamental research were done at this university with the support from government. That is the government-funded research. All these universities, they received significant government funds, and they continued their research. At India, what we are doing, here our Indian pharmaceutical giants, they are just tweaking the formula developed by these, all these foreign national organizations, and they are rebranding these products in other names. And this many times caused these legal problems and legal suits. We know these problems of these legal suits filed by CIPLA. Because these US organizations, they went to court, CIPLA defended that, CIPLA convinced the government, battle was won. Battle was won, but this war continued. We have seen the case of Novartis for the blood cancer-related drugs. But the problem is that temporarily they got relief from the court, but in the long run, it was decided that court gave a verdict that you need to have your fundamental, these researches on drug development. In US, how these researches proliferated. In US, all these top-notch universities, particularly Boston universities, that was developed by people who were engaged in opium business. That means drugs or opium, that were the major sources of economy in establishing all these universities. And they afterwards, they washed their hands, and whatever, these wrong things they have done, supplying opium to China and all these things, that was, these people forgot all these things because of the good deeds in establishing universities. You see, the irony of history is, that time China was crying against UK and US, first UK and then followed by US, for supplying opium to China, mainland China. Now US is crying, accusing China of supplying fentanyl drugs to US. This is the courses of history. Now the thing is, what we have to do, right now, we have to focus on fundamental researches. But worldwide, what we are seeing, universities' capacity of doing fundamental researches are, waning and decreasing because of intervention by government. At US, this Trump's verdict already reduced these government budgets and directed many of the students to leave these US campuses. And why US researches that proliferated? Because of this biodiversity in the forms of people's talent. We have to give salute to Harvard because they had shown the courage to stand against the government and to file a suit against the president or government of US at Supreme Court, US Supreme Court. Everywhere, here also we are seeing the same thing. At many countries, this freedom of universities are being encroached by this government intervention. And that is, this dampening and hampering the creativity and innovative activities which are happening, which are supposed to happen at these university campuses. So here, and this is the challenging part. Now we are lagging behind. To develop fundamental molecule development, new molecule development, it requires huge amount of, this investment. This is a challenging part. we have some problems. Regularly, we are witnessing the fact of reducing government budgets and grants in research, R&D researches. Public universities are getting very less amount, and not to talk about these self-financed universities. Here, researches are being only, this financed by the promoters, and it is not expected that huge amount of fund will be invested for promoting the researches and all these things in self-financed universities. So, survival sometimes a challenging issue. Now, thing is, this is the challenging part, but there is an opportunity. Opportunities of the late, what we are seeing, artificial intelligence, particularly large language model, they have caused disruptions in many things and bringing disruptions in the field of researches as well. We are not in a position till now to develop our own large language model, but we can develop short language model. All the tools and techniques are being provided by all the large language model generating organizations, OpenAI, Microsoft's. They are providing tools and techniques, and they are urging us to develop our short language model. So we can have the potential to develop short language model in pharmaceutical domain. Because advantage of India is this huge amount of, this biodiversity and populations of, these different, the varieties, different gene pools. So we have the opportunities of capturing data. We have the opportunities of curating and processing this data. We have the opportunity to develop a big data pool. And that is the major fuel for running this large language or short language model. And that can, give us a position by which we can have a breakthrough in this pharmaceutical and therapeutic research. So my suggestion to pharmaceutical, all these budding researchers, faculties, now we need to focus how to, integrate this latest development of artificial intelligence, big data platforms, and all these things to make this research more formidable in spite of challenging aspects of funding and grant. So this could be our opportunity, and if we leverage on this opportunity, then I think in future we will have a, we'll have a position, glorious positions in developing certain breakthrough research products in the field of pharmaceutics and therapeutics for the benefits of the mankind. So with this, I'd like to conclude because our Honorable Minister is supposed to speak after me. Professor Chakraborty is supposed to speak after me. So I have to cut short these things. And future, if I get... Okay. Okay. So this thing is this... Again, there is a challenge. What is the challenge? Challenge is in our culture. We have the culture of untidiness. We are not organized. At every level, at our personal level, at institutional level, at every level, we are not careful enough in systematically in following systems, in systematically collecting data, and in integrating all these things in collaboration with these other stakeholders. Collaboration is significantly lagging. Here in our country, I have the experiences of working at research institutes, at foreign universities, at public universities. I have seen, and many times I have resisted the culture of doing, this silo-based research, remain in our own domain. I know in the university also, pharmaceutics doesn't have any interface with computer science. So these sorts of culture we need to give away. And here, let us start from our case. Here we have 4 different colleges. We have different departments. So let us have a systems of applying the technology in the most formidable manner and to capture data and to collect data, because hospital is there. In our hospital systems, in public hospital systems, no system is existing at all to capture data in a meaningful manner. And in private systems, data sometimes are hidden. So this sort of culture, this we need to, as micro level, macro level, local level, national level, we have to give up for the benefits of the entire country. And then only we can survive as a nation. We can thrive as a nation. So I think I should not continue more. So thank you very much.
Thank you, sir, for your illuminating and enriching words for this inaugural session. I would now like to welcome our esteemed keynote speaker, Professor Bhashot Sundar Chakraborty, sir, to share his valuable thoughts for this inaugural session.
Do you have my presentation?
So, presentation is again in the plenary session, sir. Just a few words for the inaugural.
Okay. So, you figured out, right? I get to speak 2 times. No one else. Which no one else gets. So I get to speak.
So, are you comfortable, please?
Yeah. All right. When is that session?
So, soon after the inaugural session, there will be a tea break and then, so maybe
Okay.
within 15-20 minutes.
So would I get another cup of coffee?
Sure, sir.
Okay.
As
Good.
many as you want, sir.
Oh, no, just one. Honorable Chief Guest, Pradeep Mojumdar Sahib, Principal Professor Shamir Shamanto, Mr. Moitro, Dr. Moitro, আমি হয়তো টাইটেলটা ঠিক বলছি না আর Dr. Bhattacharya. Okay, I'll start with an anecdote, how research helps you not only in innovation, discovery, also in real life, okay? So, I was a civil servant with Canadian government. I was with Canadian FDA. And after that, I came out to the public sector, or private sector, what you call in India. And Dr. Bose is not here, otherwise, how many of you have heard of Cardizem of Pfizer, Cardizem OD? The principal work was done by my team, which I led. And then this is the second story. Listen to this. If necessary, I'll translate it into Bengali. Ba Banglai bolte pari, jeta apnader preference. So what happened, I started working in India in 2005, when I was my late 40s, okay? So I thought I would work for a couple of years and go back to Toronto. Sir? Okay. So, so what happened after I started, I found out many of the problems that Dr. Moitro alluded to. Lack of systems, data faking or lack of data integrity, not innovative ideas, tired scientists, then most of all, a big excuse of not having enough research funds. And in my actual talk, I'll show why that should not be a barrier. Now, I'll come to the real story. So I worked as the chairperson of Cadilla's Research Core Committee, or Research R&D, for 13 years. Then I retired. Retired a little, I could have worked for another 5-6 years. I retired volitionally. So, in my 12th or 13th year, and this is where you have to pay attention to what I say, okay, sirs, on the dais. So I actually, I was entitled to get a pension of 1201 taka monthly. Have some, please, this is humor, please laugh, okay. So, 1201 taka mashe. So you can imagine how much that translates into dollars, okay? And that was stuck for 4.5 years. The Indian pension system didn't give me. So what happened? I have 3 Indian ID documents, and all 3 have different names. My Aadhaar card has one name, my PAN card has one name, and yet my employer's ID has yet another name, okay? So there was a very smart lady who was Provident Fund officer, And Cadilla's HR president took me there and introduced me, like you have all kindly introduced me there. Sounds very good, right? This is sounds, only sounds that he may be a borderline VIP. Okay, borderline is important. So after that, he said, sorry, Dr. Chakravarti, ऐसा है कि आपका केस जेन्युइन है, लेकिन हम कुछ नहीं कर सकते हैं. So I actually spontaneously, reflexed. I said, listen to yourself. You are a responsible officer. Why are living officers, living human beings there? If you think my case is genuine and yet you cannot do anything, it's illogical, isn't it? Logic ko to kaj korte hobe to naki. So I said, why don't you have a good time? The HR people and the PFA officer, I went outside and I sat and I একটুখানি ইষ্টনাম করা শুরু করলাম আমি আর কি ওখানে. So the lady was passing by 5 minutes. You don't have to be more patient. Punchline is coming. Okay? So as she was passing by, I don't know what happened to me. I told her, she again stood and very honorably, she bowed her head and said, Dr. Chakraborty, I'm very sorry that I couldn't help you, but that's the way it is. I said, by the way, do you have any ulcer or acid patients in your family? I said, almost everyone. She said, everyone. And this is not a very high IQ question, actually. In India, every household has this problem. Okay? So I said, have you ever used pantoprazole? Pantoprazole, yes, actually we have. I said, the main work of pantoprazole was done by me. You know what happened? Can you guess? The same day evening, my Provident Fund, the 1200 taka was approved. So research has that kind of impact too. And I'll take a couple more minutes, and I want to show you a couple of slides when I do give my actual lecture. Our innovation, pharmaceutical innovation in India, and I'll give you a list of probably 24 companies there, at least 24 companies. Their phase 1 innovation up to phase 1, beyond preclinical. I don't know how many of you know the sequence of research. Sequence of research is discovery, in vitro, preclinical, roughly. Phase 1, phase 2, phase 3, and post-marketing. So phase 1 actually, the Indian rate is internationally equivalent or better. Phase 1 is the new drug, newly discovered drug or newly innovated drug, like long-acting preparation or something, first time being tried in healthy human beings. The rate is just about the same, and timelines are just about the same. It is when it goes beyond phase 3 and approval process, then, and I'll tell you 3 of the largest trials that where I was a part of those trials, those stories as well. Those are real as it is anecdotes, actually, as it is what happened. So it's a myth that India has many problems, but India has many strengths as well. So if we can, you know how mind works? Mind is never continuous. You have all read about action potentials, right? How long does it take for an action potential to rise and fall? How long? Milliseconds, right? Maybe less, microseconds. That's how phenomena actually really exist. It goes like that. The mind connects them. Mind connects them as though they are continuous. I don't know if you are following this. So India has all the strengths. Indians have to connect them. Okay? Is that good enough for this talk? Okay, thank you.
Thank you, Professor Chakraborty, for your humor-filled, thought-provoking words. So thank you once again, sir. So now the moment we all have been waiting for. Let us now hear from our esteemed chief guest. I take this opportunity to welcome Honorable Chief Guest Shri Pradeep Kumar Mujumdar, sir, Minister in charge for the Department of Panchayats and Rural Development and Department of Cooperation, Government of West Bengal, for sharing his precious words with our audience.
Thank you. Thank you. Good morning to everybody. It's been a great pleasure for me. I have been introduced as the minister of this state, but actually I happen to be more comfortable if I am introduced as the representative of the people of this part of Durgapur. I happen to be the Legislative Assembly member from this area, and that's what makes me come back almost every week. Yes, this week I have come little earlier than normally I do, but it's a pleasure for me to be back home. Sorry. It always rings at the wrong time. That's the problem. My apologies. Well, we had the first speaker, Dr. Satyajit Bose, after the Honorable Principal of this college, who I must thank my parents to have the foresight, had put me in the same school where the eminent cardio sergeant like Dr. Satyajit Bose had studied as well few decades later. So it was very crisp, but very, very sharp opening observations of a practicing cardio surgeon. He highlighted the importance of pharmacy and how important it's going to be in future with the newer tools that we have. Prior to that, of course, I must indulge myself in talking about the auditorium which I had the privilege of probably formally entering first, courtesy Mr. Bhattacharya, the patron and everything of B.C. Roy Educational Hub. Well, you know, I don't have to tell you that he is regarded, why regarded? He had been the pioneer in setting up pharmaceutical education system in India. And starting from a university where he had enrolled himself way back in 1920, 18 years after he was born in Bihar, in Darbhanga, he enrolled himself for engineering course in Benares Hindu University. In the very next year, he had been sent out because in those days, he had the courage of criticizing the then principal, Mr. King, Charles King, who had ensured that he leaves the university. Irony of fate, he of course studied engineering, and after engineering he left for first China, Japan, and then United States of America. Did his undergraduate degree in chemistry and post-graduation degree in I think, in chemistry and microbiology. Came back to India and joined Birla Brothers Limited. And he was introduced to the then Vice Chancellor of the same university, Benares Hindu University, Dr. Maleva, who invited him to be honorary professor of pharmacy. It is he who had introduced pharmaceutical science in the Bachelor of Science course, and then finally, probably in 1937, principal will correct me if I am wrong, the first 3-year degree course on pharmaceutical science was introduced by him. The great man came to West Bengal as head of the department newly created by Durgapur University in 1962, and was it 62 or 64? My memory, I'm a youth of 78 years, I think. So often my memory fails these days. And he took up that challenge, stayed with Durgapur University as the professor and head of the pharmacy department for 4 years. After 40 years of dedicated service to pharmacy education, he finally retired and still continued his activities in promoting pharmacy education. Great man, and in his name, in his honor, to dedicate this auditorium was very, very interesting for me. So it's been a privilege which I'll definitely store in my memory. Now, I was really not aware what was the real subject of discussion today. Usually a person who has different discipline, worked in different discipline, of course, outside India and within India, has very little knowledge about the pharmaceutical research. But what we know for sure, that most of the pharmaceutical research, as has been mentioned by Dr. Moitra, a very renowned educationist, had been our MacAut Vice Chancellor and now the Chief Advisor of this group. He had explained the challenges that we have both here and abroad. But it is a fact, I don't know the history, whether all research were funded by opium money or ill-gotten money, but it's a fact today. Most of the research work in the developed countries are definitely done by the universities, but bulk of the funding comes from private sector, what we call private sector. That's the reason it doesn't take a dime for the management of Harvard to spurn the threat that even the President of the United States of America can throw at them. Because their funding is not dependent entirely on the government funding. And there are many universities in the United States of America involved in research, both in health or in other domain, which does not receive a penny from the government of the United States of America. They attract students, they train them, many of them stay put in research in that country, and they prosper. We had done a quick survey and we realized 38% of the scientists involved in basic research work in innovation in US and Europe were from Indian origin. So, to me, the biggest resource that India has is of the great human resource, and you are part of it. We had battled for patent protection. Like decades ago, even in Europe, Switzerland had fought against their sister countries just to make sure that these scientists who had to leave the shore of India and find their mind satisfaction in paying opportunities to advance their research be given opportunities to work in India itself. I had the privilege of being a founder director of such a multinational company in India, which devoted or devotes still only in research. They sell their research findings partly or even patented technology to various organizations with priority to the basic financier, the organization which had helped to create this company. And today, I think they have patents of more than 800. The logic was that if 38% of Indians can go offshore to fulfill their aspirations of getting involved in world-class innovations, patentable innovations, so why not give them the opportunity in India, despite the lack of systems and lack of other associated problems that Dr. Chakraborty, quite in lighter vein, mentioned, but very loaded statements he made. I'm very sure the biggest resource of India continues to be our human resource. And therefore, this kind of educational institutions, which are now being encouraged to flourish, to develop, so that we can really train our highest number of youth in the world today to get involved in more productive and beneficial work. We are meeting here today, which is the World Malaria Day. You know, malaria, the deadly disease, the cure was found in India itself. Of course, we cannot but remember Dr. Russell, but the most of the scientists who worked behind the scene had been Indians. So we had that research bent of mind. We had difficulty of problems of lack of appropriate infrastructure. Today it is possible. Bulk of our artificial intelligence you are today excited about. You will find most of the brains are from India, which are actively making use of this technology. That should make it easier for us to really go beyond the common, if not conventional, perception about the pharmaceutical or the clinical solutions. It should make things much easier to convert our dreams into reality. But we must dream. An educational institution like this should help not only in training you, but also ensuring that you dream about beyond the boundaries to really contribute to the society for a better tomorrow. And there are many tools which are available in the country, outside the country. World has got smaller because of various technological innovations. We should take advantage. And like Dr. Moitro said, this institution has other faculties, other disciplines. Convergence should start at home so that you know that we are member of the citizen of the world. We should be in a position to access what is available to be accessed. There are, of course, very strictly guarded data which cannot be shared. Even in Canada, it's not possible. The patent laws equally apply in Canada, United States, all developed countries, and even in India today. But that should enthuse us to be more involved in futuristic development and innovations, because we have legal protection to guard our fruits of our research. So I wish these 2 days conference that you have should help you to gain greater confidence and more knowledge to look ahead and look for the future development in the arena where you have decided to serve the society. I wish the conference all success and my best wishes, particularly to the students and the future research workers, clinical support that you want to extend through various forms. I wish you all success in your career. Thank you so very much for giving me this opportunity. I wish you all success in today's and in your future endeavors.
It was an absolute honor to hear from you, sir. We thank you for your precious words of wisdom and encouragement and take it as a message to carry forward in this conference. Following this session, we will embark on a journey through rich plenary sessions delivered by renowned experts where deep insights will be shared and thought-provoking discussions will be encouraged. We will also have our vibrant poster and oral presentation sessions where students and researchers will display their hard work and innovative findings. The contributions of all authors compiled in the souvenir-cum-abstract book is a symbol to represent the pulse of scientific minds, and we now invite our Honorable Chief Guest, Shri Pradeep Kumar Mujumdar, along with the esteemed dignitaries on the dais, to officially unveil the abstract-cum-souvenir book of Natcon 2025 through a digital curtain raiser. Thank you, sir. Thank you, Chief Guest, sir, and dignitaries. This unveiling marks a celebration of knowledge, innovation, and academic collaboration. We have come almost to the end of the inaugural session. To formally acknowledge the proceedings, I now invite our IQAC coordinator, Professor Shobroto Ray to deliver the vote of thanks.
Good morning, everybody. It is my honor and privilege to extend a heartfelt vote of thanks on behalf of the IQAC of Dr. B.C. Roy College of Pharmacy and Allied Health Sciences, Durgapur, for the inaugural program of Bcrcp Natcon 2025. First and foremost, I would like to express my deepest gratitude to our esteemed chief guest, Mr. Pradip Majumdar, Honorable Minister in charge, Department of Panchayats and Rural Development and Department of Cooperation, Government of West Bengal, for gracing this occasion with his presence and for inaugurating the MLSTOP auditorium, the conference, as well as for the release of the souvenir cum abstract book that have set a perfect tone for the start of this event. I extend my sincere thanks to our chief patron, Dr. Satyajit Bose, chairman of the Mission Hospital and our president of Dr. B.C. Roy Society. Your unwavering support and guidance have been instrumental in the success of the conference. A special thanks to our General Secretary, Mr. Tarun Bhattacharya, for his continuous encouragement and valuable contributions. We are deeply honored by the presence of our keynote speaker, Professor Bhashwasundar Chakraborty, President of 4C Consultants, Ahmedabad and Toronto, former Professor Emeritus at Ganpat and Nirma Universities, and former Senior Vice President and Chair, R&D Core Committee, Cadila Pharma, India. His insights and expertise have greatly enriched the inaugural session, and I hope it will also enrich the audience in the plenary sessions. Our heartfelt gratitude goes to Professor Shoykot Moitro, former Vice Chancellor of MACAUT and Chief Advisor of B.C. Roy Society, for his invaluable advice and support. I would also like to thank our Principal Professor Shomir Kumar Samanto for his leadership and dedication in organizing this event. Our sincere thanks goes to our Treasurer, Mr. Jarnal Singh, and our Vice President, Mrs. Mita Mitro, and the entire management of the college for their constant support and encouragement in all spheres. I express our heartfelt gratitude to all the eminent speakers of the conference, including Professor Bhashwat S. Chakraborty and Professor Aniruddha Roy, who are present now, and others who will be joining us shortly, for sparing their valuable time to be with us and enrich us with their deep insights and visions for future therapeutic solutions. Big thanks to all the erudite dignitaries on and off the dais for gracing this occasion, for their participation, and also I extend our gratitude to the members of the press for coverage of this conference. I would also like to extend my appreciation to the entire organizing committee for their tireless efforts and meticulous planning, and that have made this conference possible. Your hard work behind the scenes is truly commendable. We are grateful to our sponsors, whose generous contributions have been vital in making this event a grand success. And last but not the least, I would like to thank all the researchers, students, and the teachers from more than 20 colleges who have joined with us today for their enthusiastic participation. Your presence and active involvement are what makes this event a truly meaningful one. Once again, thank you all for being here and making the event a memorable one. We look forward to 2 days of delightful, insightful discussions and fruitful cooperations. Thank you all.
Tea break. Thank you, Professor Ray, for delivering the vote of thanks of this inaugural session. Let us make the most of this academic fest, ask questions, share ideas, and build bridges of knowledge. With this note, we conclude the end of the inaugural session. I once again thank all the dignitaries on and off the dais for gracing the inaugural session, with a special note of heartfelt gratitude to Honorable Chief Guest Shri Pradip Kumar Majumdar Sir for sharing his valuable time with us. I now request all of you to move on to the tea break session for just as short as possible. Let us make it within a time frame of 5 to 10 minutes so that we can join immediately for the first plenary session. Our honorable speaker is already here, Professor Bcrcp Chakraborty sir. So delegates are requested to take your seats as early as possible. Thank you. Hello, dear delegates. I have been informed that 31 of you have yet not registered. So those you have not yet registered for the conference are requested to register yourselves after the first plenary session. And all volunteers are requested to ask all the delegates to come inside the auditorium. Volunteers, please guide. Orko, please see if there is, no, not that Orko, Orko Bej. Okay. Orko guys. খুব একটা না না বলছি পেছন থেকে একটু বাইরে যদি কেউ থাকে না আলো ওদেরকে একটু ভেতরে বলে দাও পেছন দিকে যারা বসেছে একটু সামনে আসতে বলো All the delegates sitting at the back are requested to kindly come forward. You can kindly come forward. All the delegates sitting at the back, the students. Yes, come forward. Come forward. Sir, we are ready. পড়িয়ে দরকার ছিল না হয়ে যেত All delegates are requested to kindly come forward. There are a number of vacant seats, empty seats towards the front rows. So kindly come forward. Volunteers kindly assist. Volunteers kindly assist. All delegates sitting in the last 3 rows are requested to kindly come forward and take their seats in the 2nd, 3rd, 5th, 6th rows. They are vacant. Please make it fast. Our speaker, sir, has already arrived. Please make it fast. Please vacate the last 3 rows and come forward. On both the sides, the last 3 rows. I once again repeat, the last 3 rows. So with the conclusion of this inaugural session, we now move forward to the academic sessions filled with knowledge, innovation and inspiration. We are greatly honored by the gracious presence of the first esteemed speaker of the plenary session, Professor Bhashwat Sundar Chakraborty at Bcrcp Natcon 2025. To chair this session, it is my honor to invite a highly distinguished academician and leader, Dr. Debnath Pali. Before inviting Dr. Pali to the podium to chair this session, I take this opportunity to introduce him. Dr. Palit currently serves as the principal of Durgapur Government College, a premier institute of higher education in West Bengal. With an illustrious academic journey spanning more than 20 years, Dr. Palit has significantly contributed to the advancement of science, particularly in the fields of ecology, biodiversity, and environmental science. He is an alumnus for the prestigious University of Kollani, from where he completed his MSc and PhD, and then has become, since then, a cornerstone in the academic and research community. His area of expertise span wetland ecology, biomonitoring, ecotoxicology, environmental remediation, and biodiversity conservation. Dr. Palit's scholarly work includes over 100 research papers published in various reputed national and international journals, and he has also authored and edited several books and book chapters. His research has received global recognition, particularly in sustainable environmental management and conservation strategies. In addition to his academic and research accomplishments, Dr. Palit is known for his dynamic leadership and administrative excellence, steering Durgapur Government College toward new heights of educational excellence. Beyond his professional achievements, Dr. Palit is also a mentor and motivator and inspiration to students, researchers, and peers alike. It is indeed a great honor to have him chair this plenary session and lend his wisdom and vision to today's proceedings. Please join me in extending a warm and enthusiastic welcome to Dr. Palit. We are truly privileged to have him guide today's first plenary session. You're welcome, sir, to the podium to introduce Honorable Speaker, Sir, Professor Bhashwat Sundar Chakraborty, and welcome him to delegate the session.
Thank you, ma'am. Thank you, Professor Samanto, for inviting me. It's my pride privilege to welcome to you all and introduce one of the renowned and outstanding researcher, academician, Professor Dr. Bhashwat Sundar Chakraborty. You know, in the inaugural session, he has say a little bit of time on the 5 minutes regarding the seminar. So, Professor Dr. Bhashwat Sundar Chakraborty graduated with B.Pharm honors from IIT BHU and a PhD in pharmacology from University of Saskatchewan, Canada. He is a former professor emeritus of Ganpeth University and Nirma University, India. Before this, Dr. Chakraborty was senior VP and chair of R&D
Cadila Pharma India and President of 4C Consultant Toronto, Canada. Prior to that, he was Director of Pharmaceutics at BioValley International Canada and a Senior Regulator at Health Canada, Government of Canada. Dr. Chakraborty has served as the Chairman, Pharma and Healthcare Panel, CII, and Senior Regulatory Advisor, New Drugs, Davos Research Foundation, India. He has also had various honorary important academic, industry, and government positions in Canada and USA. He has led one of the largest clinical trials coming out of India, trials of 2 international blockbuster drugs and 3 new drugs in India. Recipient of many honors and grants, Professor Chakraborty has 126, I repeat, Dr. Professor Chakraborty has 126 scientific papers, 68 full-length articles, and 48 abstracts in referred international journals, and he has led and reviewed more than 1,200 projects. Again, I repeat, 1,200 projects. Please have a big round of applause for him. Projects of bioequivalence and clinical trials. Dr. Chakraborty also supervised 24 master and 5 PhD students, examined 58 M.Pharma, MSc, MPhil, and 1 PhD thesis, has also many publications and interviews in non-referred journals. So it's my, again, I say, pride privilege to introduce you, sir. Thank you so much. Thank you.
Hello. Hello. Hello.
আমি তাহলে এখান থেকে ইয়ে করে দেবো। আচ্ছা। Okay, can you hear me? Can you? Okay. How? So when someone introduces you with those many big words, after that, wouldn't you like to say, who is this guy? See, my first humor flopped. That also happens. So don't take any compliments right into your head. And that's the first quality of being a good researcher. No matter how good you are in your mentation process, in your intuition, 3 qualities make a researcher a researcher. And I'll also say other 3 qualities which makes an administrator, like Dr. Shamanto. These are slightly different qualities. The 3 qualities which makes a researcher, first is a clear introspection. Introspection doesn't mean playing with your emotions inwardly. You can feel very depressed and go schizophrenic, actually, if you meant too much, introspectively. Mentation and introspection go hand in hand. Meaning, I'll give you example, actually. If I cover that, that's more important than this guy. Okay, that. So, mentation and introspection, they go hand in hand. And mentation means asking the right questions and trying to get the right answers. And it is a misconception in older cultures like India, Japan, China, and you draw a line through the Middle East, and all the countries towards the east, they're all older culture. They believe more in intuition. They don't believe so much in experimentation. And that's where they go wrong. Okay? So you'll find in India, এত লেখাপড়া শিখে আর কি হবে এরকম বলে না, তো করে তো খেতেই হবে। So, and the tone is so theatrical, then you may think like, what was Einstein doing all his life, or Newton? I mean, उससे अच्छा तो पापड़ बेलना था, नहीं? So mentation and introspection, asking the right questions, both inwardly, intuitively, and through right questions, through experimentation. Experimentation constitutes the didactic side of a researcher, and introspection observation constitutes the inductive side of a researcher. And the third quality is to be so flexible that even if you don't have enough funds, you can bring your ideas to the light. Okay? So all these 1200 projects and all that, they sound very well, but I am one of you. And most of you are much better student than what I was, probably. So, I'll give you a simple example. So, when I joined Canada, I was 22, 23 years old. And I insisted that I do a project which is more psychiatry oriented. Why? I grew up doing meditation. So, I understood a little bit of how mind works. Very little. But I insisted, and somehow the College of Psychiatry also gave an approval of that. And I was only an undergraduate from IIT BHU, and I knew two of my supervisors. One was Cambridge educated, another one was also a very good gentleman and very good in bringing grants. They both thought, this guy is okay, but he's too dreamy. Dreamy with a lot of R's in it. Dreamy. Okay? Why I say it like that? Because what happens when a person has good ideas, but it cannot be related to ground realities. So that's how you pronounce it that time. Okay? So, one of the first things I noticed was, not only me, almost everyone, we were doing a PK study of haloperidol decanoate. And its apparent half-life turned out to be more than 3 months. What the hell is happening? 3 months of half-life. And it's not a progesterone, it's not an estrogen, it's not one of those very complex protein molecules which will not leave the bloodstream. So how come? So then, thinking about it, through proper introspection and right mentation, I first posed the question, is it possible that one of the metabolites is actually coming back to parent drug? Everyone knows that. Every undergraduate student, graduate student here knows that enterohepatic recycling is a fact. It's published in European Journal of Clinical Pharmacology. And that year, it was considered to be one of the best, some 24 works in psychiatry. Okay, a simple idea, very simple. Although I cited it from my own experience, but the truth belongs to everyone else, right? Secondly, when I started working, I left Canadian services and joined the public sector. So there is a drug, cardiovascular. I wish Dr. Bose was here. He would have loved to hear this story, I suppose. So, diltiazem. And I'm talking about mid-90s. Diltiazem, lete. Diltiazem body khete. মানে 4 বার করে বড়ি খেতে হতো একদিনে। person who has either arrhythmia or other heart blockage, other heart problems, if he has to take 4 pills a day, he can go blue in the face, and because of the stress of taking the medicine, he can get a heart attack, actually. So, Huxt, Marion Russell Huxt, a German company, gave BioWell $60 million. It's the upfront fee or something like that, it is called. I never related to financial figures, but something like that. To develop once daily sustained release of deltaism. Okay, একবার খেতে হবে দিনে। আপনি ফার্মাসিউটিক্যাল সায়েন্টিস্ট দাদা? তো এতক্ষণ আমার কথাবার্তা বোঝা যাচ্ছে একটু? So Mylan actually was also given another something like $25–30 million, and this is what many brand name companies do. They actually give 2 contract research houses good amount of money. You do it first. You do it first. We'll give you a share of this and that, and you'll get your name in patents and all that. So what happened? Before we did something, they actually came up, Mylan, US, and we were in Toronto. Mylan, US came up with twice daily of deltaism. দিনে 2 বার খেতে হবে, 4 বার থেকে অনেক ভালো। So Marion Russell Huxt, oh no, upfront na, total projector cost ছিল $60 million, $5–6–8 million এরম দিয়েছিল। Then they stopped the money, and then BioWell actually gathered all the resources, invested their own money. They got panic. I actually did a pharmacodynamic modeling, and I saw, although the pharmacokinetics is sustaining for 18 hours, actually pharmacodynamically, the drug is effective for all 24 hours. That drug eventually saw the market, and a total, probably it has been sold over $60 billion, Cardizem OD. আমার জীবনের ঘটনা। So you don't have to have 2 horns, on your head or something like another appendage in order to be a great scientist. No. Einstein didn't have any fun in his personal life. Newton threatened his stepfather and mother that I'll burn you alive, because his mother actually abandoned him when he was. Scientists are not like, they're not extraterrestrial beings. They're like, but for scientists, introspection, common sense and mentation, asking the right questions, and flexibility, those are very needed. So with that, productive, do I have to really go through all slides? Can I talk? And just go through the relevant slides. Next slides, please. So these are the pharmaceutical drug research worldwide. Some problems with that. Contribution of India, India's Bcrcp-like special schemes. See, I actually spent the so-called the better half of my life. Better half, in English, better half means? So I spent that better half of my life in Canada. So my actually youth time. Some of my sense of humor, if I have at all, they are also Canadian. So don't blame yourself if you don't understand my jokes. Okay? Because you're not Canadians. So you don't have to blame yourself. Bcrcp. But I have worked here for about 18–19 years. And I was born here. and I grew up here. I had a mother who was very much Indian. And there's no mother better than an Indian mother. Right? So PRIP in that context. Major areas of pharmaceutical research. And this is where, how many of you would be graduating either undergraduate or postgraduate? By undergraduate, I mean B.Pharm. By postgraduate, I mean M.Pharm. Can you raise your hands? Be generous. Raise your hand. I'm raising my hand. Okay, quite a few. Quite a few. So, if I ask next question, Dr. Roy, Dr. Shamanto, and all other doctors, dignitary doctors, I dare, Dr. Palit, don't ask this question. How many of you want to be researchers? See, the last row, someone will, that too, the hand will be raised up to here only. Will not raise here. Me, no. You won't say, see that, this is a fact. You graduate, grab a job, okay? Have a good wife, and maybe spend 3 years, okay, in Norway, I don't know, or in some exotic Papua New Guinea. How about that? You know which country has more tin shade chawls in the world? Most. Papua New Guinea. And you know what is their dollar value? 26 rupees Indian. What do you think? What do you make out of this world? You really cannot. They have, almost every household has 1 or 2 criminals there. 90% of the houses are tin shades, chawls, you know, and their dollar, you have to give 26 rupees to get $1 of that. You know what you get with that $1? You give 26 rupees, they give you $1, and they give you 1 betel nut and take that dollar from you. একটা সুপুরি দেয় ওই 26 টাকা দিয়ে। So such is the world. Examples of low budget. Why do you think sometimes humor, especially in the beginning, humor is important in a good talk? Not always. What humor does, it relaxes you. When you are relaxed, you can focus better. It's not that you had a dream of being a stand-up comedian and you failed in that and you became the president of 4C Consultants. It's not that at all. No, it's not that. And then, are you enjoying back here? I don't know. My rear view is not all that good. So, example of low budget. This is what I would like you to focus on. Areas for young scientists in India. Next slide, please. So this is the burden. First of all, look at the number of new molecules. Look at 02. There were 15 plus molecules and total cost, look at that. Over $10 billion. So today that may be $20 billion. Okay? So that's how the world, developed countries are creating a gap. Why? Cost of all types of resources, including the constant part and the living part, Marx theory. And then last stage, late stage, stage 3, stage 4. Clinical trial stage 3, clinical trial stage 4, you have to drop that molecule. Then all your $338 million are gone down the drain. Second is focus on the diseases in developed country. So they have, developed countries have developed this. In India, have you seen anyone with melanoma? Skin cancer? Because we are darker than them. That's an advantage. যদি কেউ বলে তো কালো বর পেয়েছি মন খারাপ করতে না we don't get melanoma. So you can tell them যদি বউ বলে যে কালো বর তাহলে বলতে হয় তোমার আমি এত 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 লক্ষ টাকা আমি ক্যান্সারের ট্রিটমেন্ট থেকে বাঁচিয়েছি না লজিক্যাল কিনা কথা নেক্সট স্লাইড ডক্টর পালিত আপনি কিন্তু এটা মিস করলেন আমি এক্ষুনি যেটা বললাম হ্যাঁ তারপর পেটেন্ট অ্যান্ড প্রাইসিং ইস্যুস সি the World Trade Agreements, patents, those were initially, they were balancing acts so that innovative brain power, they get rewarded. And also, worldwide, there is a fair distribution of all the innovative drugs that people need. If you have a body, if you have a mind, then diseases would be there, right? You cannot help it. But if the distribution system, the burden of, like developed countries have their own burden, developing countries have their own burden. And patent and this World Trade Agreements, TRIPS, they actually haven't been able to address the equanimity point. Too bad. And fourth point is the regulatory challenges. So I used to have this problem, tremendous problem. Say once in a while, I was main person in the Bureau of Biopharmaceutics Evaluation in Ottawa. So 85% of drugs which were, of those 85%, 80% would be generics and others would be modified dosage release forms, actually. The innovative molecules sometimes used to come to me. And then the innovator would not give this data, would not give that data. They'll file. You have any idea how much an innovative, someone said, I think it was Dr. Shawant or someone who said, the money the innovative companies spend in litigations actually to put the generic competition down. And brunt of that comes to regulatory agencies as well. First of all, Cadila developed a drug, I'll discuss that. So the 3 studies cost them 250 crores and they thought, oh boy, we have spent so much. Turned out, the number of studies that US FDA demanded and the studies we did, those studies were not even 10% of what they required. So they want a systematic, not only discovery is only a small percentage of the total drug development picture. So this is why the regulatory burden, you can call, burden is always, burden means whether it is Banglaয় দুঃখ বলা যায়. Burden means burden. Okay. And finally, need for collaboration and policy changes. So public-private, we keep talking about this. And India has some good histories, but it is nowhere comparable with developed countries. You know, you go to countries, small countries, countries with small population. You know, there are countries, whom should I talk to? There are countries which have population less than Durgapur. So, I mean, you can imagine there, what policy they are going to have? And what kind of public and public and private collaboration they are going to have. So policies need to be very pragmatic actually. These are some of the challenges. Okay, next slide. This is old slide. This is, don't go by that 2015. Right now, this is about 800, 900. There are 900 more. So about 2,700 registered R&D facilities in India. How many? This number is most probably more than that of China. China से अभी हम population में आगे हैं and number of research houses में भी आगे हैं. तो दो चार और कदम बढ़ाए तो चाइना को दे सकते हैं हम. So next slide. Now this is a very interesting slide. I don't know. Can you see that there are green dots and there are red dots? Can you figure out? Red dots relate to Indian history of drug discovery and development. Okay? And you can see it started much later. The green dots start just about the same time First World War happened. Okay? So after First World War, many things came along. Sulfonamides were a big antibiotics, some other drugs, and there were drugs like aspirin. You know, in India, actually, there were Ayurvedic tradition, which is not something that is very trivial. It's a great Ayurvedic and some Unani too. Okay, but Western style started with CDRI, early 60s. And they actually, they started with a progesterone receptor antagonist, which, centromone. Thank you. I couldn't have read that. I don't have full eyesight in my left eye, actually. So centromone, rotovac, and there are many others. I'll show you some other slides where names will not be named, but you'll be amazed how many research initiatives actually take place in India. And all of you can do that. The first thing, right now, along with those three qualities, mentation, in scientific introspection, flexibility, you'll have to have a fourth thing, and this is paramount, which is teamwork. The days of solitary work, they are gone actually. Now you want to succeed, you have to do teamwork. Okay? So, the pantoprazole thing that I told, it was Big Gulden's project. And that days actually, when I started working on it, right now if you want to measure the pH in gut and stomach, you can capsule, like a capsule moton electrode পাওয়া যায়, ওটা খাইয়ে দিলেই হলো। হ্যাঁ, তারপর আবার নিজেই ওটা বেরিয়ে যায়। তখনকার দিনে কি করতে হতো? না, নাকের মধ্যে দিয়ে মানে দড়ি না, electrode ঢুকিয়ে, হ্যাঁ, actually. And pantoprazole became one of the, আমি একটাই স্টাডি করেছি pantoprazole মেইন যে স্টাডিটা আর কি, মেইন ক্লিনিক্যাল ট্রায়াল. So those things actually went along. So India became actually gradually, and India, as Mr. Majumdar was saying, and some other eloquent speakers were telling you, Indian brain is naturally thinking and scientific brain. Somehow, we have forgotten that existential truth of ours, that we are actually good in research. So we actually first go to Europe or to Canada or to Australia. Then all of a sudden realize, oh, I have a brain. No, isn't this true? Why can't we realize it right here? So the flow of, this is innovative work. And the generic work that India has championed, it's incredible, incredible. Only thing is, there's a proverb in English. It's penny wise, pound foolish. Right? Everyone knows the meaning of that? Bojro atuni, fashka gero. Penny wise, pound. Actually, we do that. We can. This is the front end of your, say you are the #1 generic house in India. And listen to this. If you can stop the traffic, probably some people will enjoy a little more. So front end, they'll do for MHRA, US FDA, Australian, New Zealand, and the whole world. Okay? Back end, they'll use the acetone, which they can buy for the money of a cigarette packet. And you know for which country? They'll do that for India. Same generic. Domestic market. This is a complex. This has to go. That's the only thing. I don't know why we don't have, I don't want to emphasize, my focus is not to criticize Indian system today. My focus is to bring out the Indian strengths. Okay. Next slide. LMIC means low and middle income countries. And many other countries, looking at India, how India developed in innovation, generic development, long-acting dosage forms, etc., like Vietnam, Malaysia, Indonesia, they are also actually getting ahead, getting inspired, and right now they are also trying to emulate us. Next slide. Spend a couple of minutes in that, and no one moves during this slide. This is the best slide. Although it looks very humble, but this is the best slide. Just look at this slide. उधर पीछे जितने जेंटलमैन हैं और जितने लेडीज हैं, सब इसको देखें. Look at the phase 1 data. What do you see? What is the international standard? They are comparable. When it, exactly, it's a little better actually. When it comes to phase 3, then the disaster happens. And what is phase 3? Not faculties, please. Please, help me out. What is phase 3 in drug development? Clinical trials. That's where it fails. Not only statistical failure, it actually fails in medical, it fails on 3-4 things. First of all, idea was not well conceived. Protocol was not well written. How to capture the adverse reaction profiles, that was not well written. Then, data treatment and data integrity were questionable, so on and so forth. And you won't believe how many research houses have been penalized by MHRA alone. Can you guess out of those 1,800, how many, that's 10 years ago, that's the data from 10 years ago. How many research houses have been penalized by MHRA alone? In excess of 300. Isn't that astonishing figure? So phase 3 and timeline also, when it comes to phase 3, the timeline is not too bad, but the leadership, the ability to actually get the funds and get it approved by one of the stronger markets of the world. That's where the difference is. Is that clear? In Glenmark alone, you won't believe what a strong pipeline they had of innovation. But they haven't been able to, not a single Indian company. Vaccine scenario is different. There we had much better success. But new chemical entities, this Dr. Subramaniam, Dr. Subra, he had 3-4 innovations, none of which is credited to him. And that's true about, in general Indian innovation. So, contrary to popular belief that India only does, Dr. Banerjee of engineering, civil engineering, was asking me this simple question, which every educated person who is not pharmacy or medicine related asks. Does a generic in India have... And did you read this paper, any one of you? Isn't this marvelous, Dr. Reddy's? Look how many compounds they are researching on. This is a little old data, but still, now this figure has improved. And this is not one of the Indian authors actually. There's no bias in it. Until the last company, there are about 24 companies here. And look at the therapeutic categories here. There isn't a single important therapeutic category which is missing from this slide. So Indian companies have this ability to actually innovate. The problem is that their main thing is the financial resources especially run out as soon as phase 3 begins. Do you have any idea, anyone, how much the phase 3 and just the phase, just the works that are required before approval, pre-approval period, including phase 3, how much that costs of overall budget of drug development? Starting? Huh? Yes, exactly, 70%. It's an amazing figure. So actual discovery doesn't actually cost that much. Sometimes it's actually, it's very little, It's like Alexander Fleming's story. Right? Yeah, exactly. Next slide. So a few examples of successful drug discovery. Dr. Reddy's, 1997, they outsourced. Then Torrent. Glenmark is this case in the point. I have given some dollar figures, but more importantly that they had 5, Glenmark had 5 NCs, and these were very difficult, therapeutic categories. Okay, students, can you see this? Okay. And then Zydus, our own company where I worked, Cadila had few. And not only in NCs, NBs, kits, and sometimes devices as well. Devices is another story. If I get another chance, we'll tell how to make. India is a great place to develop devices actually. Not only because we have the patient pool and the genetic diversity, there are many other things. Okay. Next. See, I'm not rushing. Only thing, I'm acknowledging a physiological need of having food. You can have a good lecture. You can have a very heartwarming talk. But if this Narayan is, foodless, then you don't enjoy it that much. This is why I'm not rushing, but going through the slides, through the key points. Now, contributions of Indian R&D, and by the way, you can have these slides if anyone is interested, and all the important references are given at the bottom, not this one, although. So, vaccine Then, during COVID, we have seen, so, if you get irritated, what if you get irritated, what happens? You are not a person who has a high index of irritation, frustration cannot be a good scientist. This is why I am not such a good scientist. Okay. Then during COVID time, then Ayush has many various things. You can go through this, but this is again proving, I want to come to some typical anecdotal slides and some of the main themes of why a research becomes successful. Next slide. Government initiative PREPS, it has two main components, and you all know that. One is all NIPER subs have center of excellence, and there are some specific areas where government actually funds willing. Next slide. And this scheme, you know, not only PRIP, PLIs and bulk drugs and so on and so forth, there also government has tremendous, this is how many, 10,000 crores or something like that overall. Maybe the funds have increased actually. So together with center of excellence, and together and along with these other schemes, Indian government has a lot of encouraging schemes by which you can find jobs. And very few of you will enter into research and development. But the principles are exactly the same. Whether you work in research and development or in sales or in production or in quality control, or you still have to be very motivated, very focused, and you have to be a little bit selfless, little bit, not that much. Next. So there are these 4 slides. If I can, this is where my teacher side comes out, and I am not as worthy teachers as you are. Let me confess that. I'm a very average teacher. So let me go through this slide. Research outcome. Let me quickly give you an example. You are like me. You have spent 27 years doing research in Canada. You have come to India. And the first projects that here your employer gives you, first few projects are those projects which have been put in the dustbin by ICMR, NII, and CDRI, and PGI Chandigarh, and all that. And this is exactly, they want to test you, you know, whether, and this is what I have gone through, actually. Oh, does he really know what he talks about? So I had never done cancer research, and I was given a project of NSCLC, non-small cell lung cancer. Hello, be with me. Non-small cell lung cancer. 226 was the total number of patients which were needed for ITT. ITT is intended to treat. Intended to treat. Meaning, this is what, see, if you decide that my phase 3 data will be evaluated on these many subjects, and they may complete the protocol or may not. That's what FDA will look at. And that's where you need medical significance and research significance and statistical significance. This is where it becomes so difficult. So, a false positive, type 1 error, what happens? In that 226, in first 3 months, I had 80 patients dying. Because what happened, I told them I had 8 centers. They were all good centers. And the investigators told them, no, these people will survive for some time. And they had lung cancer. And if they die tomorrow, why would I recruit them? That is artificially, I'll get a false negative, right? So, they actually told me, and then they, out of enthusiasm, they recruited the wrong patient. And my p-value was coming, you won't believe. It was so bad. I said, let us go through the thing. And it took me about 2 dozen of trips to Delhi and other places and convincing a whole lot of things. A lot of question about my credibility. And by the way, communication doesn't need only on your academic or character qualifications. As I said, it also needs your ability to communicate. A little bluff can work sometimes. Or good logic. You say, just think, a cheap drug costing only 3,000 rupees per injection, coming out of India and working for 3 major cancers. Exactly that's what happened. The drug is, you can, those who have mobile handy, you can figure out. Mycidaxi. It actually. So don't get, the interim analysis is the point where you look at the interim results and try to figure out whether eventually I'll get a true positive or true negative. True positive is, statistically speaking, go to the next slide and that. So, true positive is when you do not reject a true null hypothesis. Oh, that sounds mouthful, right? One of my supervisors, who was not Cambridge educated, if it came to type 1 or type 2 errors, he'll take a sick leave actually. Yeah. So all the NDAs that came to him, and ANDAs, externally sources. You see, that time Canadian FDA had very limited resources. So a lot of big names in universities, they used to outsource the NDAs and ANDAs to them. And some of them I got, because I understood how the type 1 and type 2 errors count. And I used to have per NDA, you know how much fee they charge? One, if you are a professor in US or in Canada or in Sweden or in Australia, one NDA, just the PK portion, just the pharmacology portion, just the pharmaceutics portion, one NDA to review, you'll get at least $25,000. You know how much I got? $500. I learned. So, this picture, and this says that actually you cannot accept the alternate. Say a drug has anti-cancer activity. Okay? That thing is so rare, you have to prove it. What? You cannot reject a true null hypothesis 95 out of 100 times, or have at least 80% power. Meaning the beta true negative rate has to be at least less than 20%. And true positive rate has to be less than 5%. This is what I was talking with Dr. Bose this morning. Confusing a little bit? If you do this, you can have a career. Just these two slides. And this is not the only thing. They will also see the specificity and sensitivity. What happens? Suppose that cancer trial, 200 out of 226 patients, 80 died. And you actually finally complete the study and study comes out to be positive, true positive. At least you conclude that. P is 0.049. You add one more study, and if it becomes 0.0, say 060, then this will be called what? This is a high sensitivity. If you change just one thing, just add one more study, the whole outcome is changing. So this is the high sensitivity. This means the study has low specificity. The study cannot be relied. Is that somewhat clear? If you have type 1 error too low, your type 2 error will start increasing. If you try to make a study too sensitive, your specificity will go down. If you make the study too specific, there are studies which are so powerful. Say the beta error is only 3%. So power of the study is 97%. In 97%, what happens? You add, it is a case of high sensitivity. You add one more aberrant case, the whole study fails. So one outlier out of 100 can fail your study. Now those are the things you have to be, in order to be a smart researcher. And another thing, never ever in your, dream of dreams, do not think of faking data. It's not fun. Once you do that, you'll be tempted to do it the second time. I actually thought of going back to Canada several times because I found this is a serious problem in several places in India. Okay? They feel the pressure that once I caught someone, 2 male nurses, who actually faked the ECG data of 2%. Why did you do it? We thought that Cadillac will look good. These were WHO listed data. I forgot whether it was tuberculosis or malaria, one of those. Okay, very sensitive, actually. Next slide. So these are the 5 main areas: discovery, development, including preclinical research. This includes also in vitro data. Then clinical trials. Clinical trials could have come first because that's the, in sports, in real life, how you finish often becomes the most important part of a process. Isn't that true? Second row here. You thought that I was not paying attention to the second row, right? But I am. She's becoming very serious. What happened? You were following me? What? No, if I push any more, she'll feel nervous. Okay, so clinical trials. So what I am saying that sometimes finishing is the most important part of the whole process. This is why phase 3 studies, phase 2 also. Phase 2 is the proof of efficacy. Phase 3 is proof of efficacy and safety both. Then QA. You cannot actually say that that is less important. All are important. And those dots, how many dots are there? There are actually more dots. You know, one of the largest pharmacovigilance centers of the big companies are right now in India, like Novartis, Glaxo. Can you imagine just how many records do you think Novartis has? CRFs. It's actually almost equivalent to US FDA in volume. Amazing. Okay, next. 5 major areas. These are the ones. And you all are more or less familiar with that. You can find good employment in any one of these. See, Dr. Samanto, they are feeling hungry and they're leaving. And usually in my talk, I find very few people leaving. And I'm a little sensitive to it. I'm used to people actually sitting and listening. Not me, but the topic. Next. Regulatory affairs is a very interesting area. See, not all of it is logical or knowledge-oriented. Sometimes it is a rule that is coming down from Adam and Eve's time. So it's coming, and no one really knows why you need 20 or 25% HPLC data. You know? So you can actually, you can do with less, or sometimes you can need even more. So some of that is like real life. It's just coming down. Biotech drug development is another area, not only for biosimilars, but innovations. These are big molecules. Big means really big. And nowadays it's time of monoclonal antibodies, right? Characterizing them, analyzing them, developing them, purifying them, doing post-marketing surveillance of them, all are very difficult areas. Next, examples of low budget. 5 slides I'll go through quickly. This is an amazing example. This is, you all understand Alzheimer's disease? I hope no one in your family ever has it, because it destroys a beautiful personality. Actually, my mother-in-law has that, and she has always been, even now, an adorable person. Right now, she's the last stage or advanced stage of Alzheimer's is psychotic. They cannot, they can't even recognize their own face sometimes. Their children. They cannot remember where they live. Very, very pathetic, actually. So what happened? They did 2 studies. And the studies do not come to a real significant conclusion. Okay? So what they did? They did simulation. Can you imagine a drug? This is US FDA I'm talking about. And they actually simulated the data. Everyone understands simulation? Can anyone tell what are bootstrap? Have you heard of them? Resampling. So you have small data, you have 20 observations. If you can resample from them and generate 200, 500 observations, that's a simulation. So what happened? They did a simulation. And next, and you see the top one is the placebo. And the bottom 2 are there, they both reach significance. So by simulation, they actually, this is, there are 2 things that happen during Alzheimer's. Tau proteins and plaques in the brain. They actually interfere with all aspects of cognition, memory, short-term, long-term, and all the beautiful aspects, confidence, and everything gets. So simulation actually rescued this study, and this study was actually approved. This is what I had. If you do, what is that? right to information. 1990. That time our institute used to be called Drugs Directorate, and I had suggested this. And wherever there is a borderline case, especially in these, see, when the dose response of a particular therapeutic category is shallow, what is the harm of doing 10,000 simulation in there? So you'll at least get an idea. It's much better, and you are actually resampling from the real data, right? Next. So this is the first. How much does a simulation cost? How much? Dr. Mandal, how much? 16,000 rupees. Small. If you have a better computer, 60,000 rupees. And that's how much in dollars? So you'll spend much more than that if you dine at Times Square in New York than doing this simulation. So in generics, India, in biosimilars, India is third. And in generics, no one has to say. India is the hub of the world, pharmacy of the world. And generic development is not a child's play. Those who have done, and I'll come to complex generics, these are so difficult to do. Okay? So in generics, India is, and in generics, Cadila used to say, oh, Dr. Chakraborty, you have 2 crores, 2 crores. And this is their voice. 2 crores of rupees to develop, say, a generic of sildenafil. 2 crores. It needs at least 10 crores or, this is not easy. Oh, next thing you hear that they have cut 40% all across, so that budget is also cut by that amount, that margin. And this is how Indian actually generic scientists develop it. And it is kudos to Indian scientists how they develop generics in India. So we think, oh, Sun Pharma, Cipla, and 2 more, they are the top 10 generics of US market. But worldwide you take, it's almost half. Okay? And the budget is not much. চাঁদা তুলেও 1 কোটি টাকা জোগাড় করা যায় না আজকাল? করা যায় কিনা? মানে আমি এটা বোঝানোর জন্য বলছি যে এত ইয়ে না আর কি, যে আমরা যদি খালি নিজেদের এই অজুহাতটাই বোঝাই যে ইন্ডিয়ায় টাকা পয়সার জন্য ভালো রিসার্চ হয় না, অন্তত ফার্মাসিউটিক্যাল রিসার্চ তাতে ফিট করে না। নেক্সট, দিস ইজ এ ডিআইএ কিনোট টক দ্যাট আই গেভ। So look at the categories. The first one is peptides. Second one is liposomes. Third one is locally acting complex drugs. Yes. And look, they do not have to go through the 505(b)(2) route. 505(b)(2) is, by the way, you have to do a full clinical trial, which will cost you a minimum of $5 to $50 million. And this you can easily manage with $2 to $3 million. So cost is not my main focus here. Main focus is when in problem solving there is a basic principles. First, you take out the paradigm, it cannot be done from your head. The moment you think that it can be done, something like this comes out. And look, there were 2 references that are used. You know, whenever you use 2 references, the power of the study goes down. Even then, reference 1 was bioequivalent to reference 2. And the test was bioequivalent to reference one. I wish I had more time to go through it. I actually get very cracked up explaining scientific data. Nesha jaka bole na nesha uram mone hai amar scientific data. So unfortunately we don't have that much time. These are all low budget, high genius, high ability, good logic, good observation power type of research. Next. Orphan drugs. Orphan drugs in India it's not very popular, but in US it's actually anything that affects only a few people, say 200. Okay, there also you can use a variety of low budget and innovative approaches to evaluate and do the research. And here is one example. I want to go to the next slide, which is similar. Next slide. This is the same. So here you actually have responders is the bottom one. It was, see, you get very little funds. But here there is an example where responders actually proved statistical significance. Next. Publicly funded research. These are government agencies like, I hope one day NIPER or CDRI had many successes. Many of them were commercialized as well. Next. Okay. This is why I skipped that slide. This is LEW 17. This is actually what happened. There was one study. Then they found in other parts of the area of the world, there were real world evidence which actually corroborate the result of this. And originally in scientific community we thought we cannot mix this study and that study, because this study has one kind of history, one kind of, in terms of domain of time also they are different. You cannot mix the data. Right now, with robust data, big data, real world data, those restrictions are taken away. Next. And you can see the overall survival. This is for cancer. In cancer, these are Kaplan-Meier plots. In cancer, what happens if you have a significantly higher survival for your experimental drug and that reaches statistical and medical significance, it's approved. So you can see both per protocol and intent to treat are successful. Next, almost done. Now, all of the research coming out of India are not low budget. I was involved in all three of these. Look at the budget. So first one is published in Lancet, second one is American Journal of Cardiovascular Drugs, and third one is New England Journal of Medicine. These are not very ordinary journals. These are journals of very high impact factors. Okay? And the first one, and this is Wellcome Trust, actually, they themselves came forward. So I got this phone call, and the other end, the person said, "Hello, Dr. Chakraborty, this is Shishendu Mukhopadhyay calling." So I was sitting like this, I stood up. I said, "আমি ছোটবেলা থেকেই আপনার গল্প পড়ছি। আপনাকে অ্যাকচুয়ালি আমাদের বাড়িতে বাবার সঙ্গে কথা বলতেও দেখেছি, দেওঘরের বাড়িতে। Are you talking about the person of letters, Shishendu Mukhopadhyay? No, I am based in UK and this. 5 million Great Britain pounds, 11 million Great Britain pounds. So money is not the main thing here, but they were convinced that a combination drug can actually lower the basic risk of heart attack and cardiovascular problems. Okay, next. And this is the clinical trial share. It's very low. When I came to India, I thought, that was in 2005, I thought the figure would be somewhere there in 2 to 3 years to the right. Right now it is little over $2 billion. What we deserve actually, this figure to be like at least $20 billion. Probably one day it will be, but right now it is not that. Next slide. So you can see for high budget, high innovative work, there is work for you. Low budget, generic drugs, complex generics, data analysts, artificial intelligence. You have all these areas open to you. And of course, there are areas in sales and marketing, in production, in quality assurance, in analytical. So a whole lot of horizons are there. Do not cherish this in your heart that I have to somehow hang on to a job and that's the purpose of my getting education. Next. So potential employers are both in government and in public sectors. Okay? Next. This is what happens when you start with humor. We all are living. They enjoy the humor part. Abhi daga kar rahe hain na? They're betraying us. Look at those guys. जो ही humor खत्म हो गया, इसमें भी humor है. You do good research and you get good results, and the results actually gradually, 4 o'clock in the morning, you wake up dreaming of some data, beautiful data. Isn't that humorous? I shouldn't tell, should I? You're sitting on the toilet seat and you get good data in your head or good interpretation. So those parts are very humorous. Next slide. So these people love this slide. Actually, not the content of the slides, and it's the heading. And you know who loves it most? The chairperson of the session. I feel so helpless when I have to rush through. One of the slides, whenever I rush through, I feel as though I'm cheating myself. This happens because I'm kind of addicted to good data and explaining to them. Conclusions is India has enough brain power, and India is also now, it's not a poor country anymore. Yeah, if you want to see that Shishendu Mukhopadhyay story, remember that can happen to any one of you. First study, very first study I did in India. Cadila hired me at 1/50th of salary that I used to get in my previous employment in Toronto. 1/50th. If they gave me 100 rupees, Kerala was giving me 2 rupees. And me and my sense of humor, during the interview, I told them, I liked the job, even if you give me 1 rupee, I'll do the job. They actually ended up giving me 1 rupee. They never say this in an interview. They'll take it literally. So this is my only advice after this noble session, that don't say such things in an interview. So I calculated I needed, for the first 3 studies, I needed about 16, 17 crores. And you won't believe, DVT gave me some money, Cadila gave me some money, few others, and others said, oh, you are a Canadian citizen. No, we cannot give you money. We are a very pure country. We cannot give you money. I said, I was born here. I can speak many Indian languages and I understand Indian emotions and Indian jokes. No, they wouldn't give me money. Finally, I had to convince my UK and Canadian clients, give me money. And most of them are the clients from my FDA days. You know what is the advantage of being a regulator? If you tell them, you have to do this study, they'll do this study no matter what. This is true actually. Most of them are kind of, one Australian regulatory director in a company came to me for a study in Ahmedabad, and I said, look, you have done these studies, why don't you challenge the authorities, the regulators? They are asking too much from you. Oh, no, I thought I have to hospitalize her. You know, they are so scared of regulators. How can you go against a regulator? So, the main thing is to believe that it is a human process. You can do it. Second thing is, our history since 1960s especially has been great in pharmaceutical innovation and generic development, biosimilars, vaccines, and many other areas. Third is, remember that research is simply, it's a wonderful game of finding the facts. More specifically, finding the truth. More specifically, finding true positives and true negatives. Finally, you can do very high-profile jobs as well. But if you do something like, 60,000 rupees simulation, don't think you are any lesser scientist. With those words, I want to conclude. I'll give you 3 minutes, exactly 3 minutes, not even 10 seconds more than, to have at least one question. Otherwise, I feel I haven't done any good work. Okay? So ask me at least 1 or 2 questions. I had to rush a little bit. I hope it was not too bad. Was it too bad?
Hello.
Sir, thank you, sir, for this session. I am Sincere from Pharmaceutical. Regarding the contribution of these modern innovative ways of drug development in Indian market, and in this current scenario, AI more than other, is there any scope of AI in future? Discussion also.
See, that's first thing you have to understand. But, like AI can do one thing. AI can actually multiply the efficiency of simulation. See, AI definitely has, but AI cannot generate original data. AI should not, you should not give AI, like in writing a manuscript, you cannot use AI. Now, there is a thing called AI humanizer. As if one evil was not bad enough. একারামে রক্ষে নেই সুগ্রীব দোষরের এটা আছে না? হ্যাঁ। So as if one evil is not bad enough, there is a humanizer now. No, you cannot do that. But there is AI is what basically? AI is a data mining mechanism by which either you develop the model from data in situ or there is a previously developed model. There are many other aspects of AI. So definitely there is I mean in checking data integrity. It's a great tool for checking data integrity. If you have electronic data, and if that data has been, how do you think the mass spec, fake data or ECG fake data are caught? Okay. So you could, and if you have AI, good AI applications, and you have real data, real means real. Do not get, one thing for innovative, do not get afraid of, am I going to get positive result? Well, if the reality is not positive, why should you get positive result? Yeah, target is truth. And truth doesn't have to be according to what your expectation is. Does that answer your question? Next. One more. Yes.
Good afternoon, sir.
Sir?
Thank you so much for such a wonderful and
I am not satisfied because I have to rush through this, but I cannot blame your principal either.
I'm Shobhan Shiwar. I'm second year student. I have actually two questions. So, sir, actually my question was, you said in one of your slides that in India new molecules are being discovered, but their percentage of success is diminished in the phase 3 part.
Right.
So what is India making a mistake, and what are the other countries like Canada, USA, UK, they are doing successfully, that their percentages of producing a successful molecule is more than India?
Okay, first of all, the calculation of sample size for phase 3 is under a lot of duress in India. Because the management and the funders will say, do it within this. So if they ask you to buy a 24-carat ornament, gold ornament, 15 grams for 200 rupees, what are you going to do? You'll draw a golden ornament on a piece of paper and give it. And this is what happens actually. So that's one aspect. Second aspect is, I think somewhere there is a lack of real life experience. And experiential currency cannot be undermined. Experience agar hai. Why am I talking in Hindi? It's a wonderful language. So if you have the right experience and right knowledge, you'll find a way of at least, see, phase 2 is what? Proof of concept of what? Efficacy. Phase 1 is proof of concept of safety. Suppose you get such phase 1 data, phase 1 always gives you a hint of efficacy as well. Okay. So you can start actually, how do you think Pfizer started like any other company? Sandoz was like this. Sandoz, if right now Novartis is this big, when my entire PhD project was financed by Sandoz. Although I got Canada's national scholarship, that's different. They started like any other company. They learned how to generate money, funds, convince people, convince government agencies, And that welcome trust story that I told you, that's not a story. That's actually, that's as it is reality that I face. So when you try to figure out why, you'll find there are 10 whys. I teach a subject which is called design of experiments. So among those 10 whys, you have to choose what are the 4 most important whys for India. And that can change from one project to another. Was that a very complex answer, or is that part? Critical attributes. Otherwise, what will happen? You may get lost into a lot of small things, and eventually blaming the system, blaming the funds doesn't help. What was the second? Quickly.
The second question was,
Somehow I can.
in your conclusion slide, you said India is producing a lot of generic medicine, but I think within the Indian citizen, there is some prejudice regarding the generic medicine that it may not be.
Dr. Banerjee of civil engineering was asking.
Is it that a
Yeah, in some cases that's true. In some cases that's true, and I can say this standing in front of DCGI or anyone. So Jian Singh, by the way, was a classmate of mine, and we are very good friends. And Jian Singh won't protest. So India, what is that drug? That's for neuropathy. I forgot. The brand name works in India. See, India, ranitidine is made by Glaxo and by Cadila as well. You'll find, not because I was an employee in Cadila, you'll find there is no difference in efficacy. But there are CNS drugs. In GABA derivatives, you'll find actually there are CNS drugs, many drugs, you'll find there is a difference in brand name. But in general, as a principle, see, the thing is, you have to understand bioequivalence is pharmacokinetic endpoints. And where pharmacokinetic endpoints can be somehow somewhat questionable or irrelevant, there it will not work. Okay? Huh. এইটুকুই ঠিক আছে থেরাপিউটিক ইকুইভ্যালেন্স ঠান্ডা করে দিচ্ছে এক মিনিট ডিনারের সময় হয়ে যাচ্ছে আমি জানি তো থেরাপিউটিক ইকুইভ্যালেন্স হচ্ছে একটা আধ মিনিটের একটা গল্প বলতে হ্যাঁ আমি বুঝেছি সেটা লিভোথাইরক্সিন in the developed world this person was the first one who approved a generic and 25 milligram dose microgram dose আর সারা কানাডার ডাক্তার they turned against me. Narrow therapeutic range drug, such a low dose, how can you approve a generic of that? তো ওদের ধীরে ধীরে ওইটা বোঝাতে হলো যে না যত obscure হোক there is an internal connection between therapeutic equivalence and bioequivalence. Certain things you have to believe also. Then only you'll get the right logic. With this, you have been a wonderful audience. I think I got
academician, industry expert. So I think this is the time to felicitate, and ma'am will announce the program. Thank you so much, sir.
I would like to request our Honorable Principal Sir to kindly come to the dais for the felicitation of Professor Chakraborty Sir. You are requested to calmly join on the dais to begin with the felicitation. Gift. Gift. Hey, স্যারের হাতে। Thank you, sir. We would like to request Dr. Palit to kindly come forward, requesting Principal Sir to kindly felicitate Dr. Palit. Thank you, sir. Now, dear delegates, we will be moving to the lunch break, but since we are running a little late in time, so I request all of you to have a quick lunch and join here by 2:30. By 2:30 sharp, we will start with our next session. So please have your lunch fast and come back here soon. Thank you, one and all.
Hello, hello. Hello, hello,